friends. I'm Professor Dr S.K.Chugh, M.D Medicine. Today I am going to speak on the subject Appraisal of COVID-19. Other day, when I picked up Hindustan Time newspaper in the morning, the headline by World Health Organization chief was that the pandemic is accelerating and we are in a dangerous phase. The very next day, the additional South Asia Regional Director Jean Go stated that without urgent action, now COVID-19 could destroy the hopes and futures of an entire generation. That is what prompted me to review the subject. Let us see how much improvement we can bring when our creative intelligence works at the world level in a mass way. COVID-19, as you know, is a disease caused by coronavirus, which is a novel virus, a very virulent respiratory disease virus. The disease is spread from human to human by droplet infection. If a patient who is positive or is in the incubation period happens to sneeze and drops droplets, and you happen to be at a distance less than 1 to 2 meters, it's a likelihood that you inhale that virus, and as I said, it's a very virulent respiratory virus. The disease is spread from human to human besides human droplets. If the droplets are spread on a surface and it stays for a longer period, and if you happen to touch the surface, then again you are susceptible to infection. Now I would like to say something about the initial symptoms and signs of COVID-19 disease. The incubation period of the disease varies from 5 to 14 days, and the symptoms are fever, running of nose, sore throat, body aches, headache, fatigue, loss of appetite, diarrhea, loss of smell, loss of taste, and it may also be associated with other symptoms depending upon the severity of the disease the patient is suffering, whether it is mild, it's moderate, or severe in type. The disease is confirmed by culture of virus from the nose, from the throat, and in due course of time, when the severity of disease increases, then patient may present with pneumonia-like picture in the X-ray. The CT also shows those pneumonia-like patches. The patient has to undergo blood tests for viral antigen and the response of the human body to the antigen, that means production of antibodies by blood testing. Like diabetes mellitus, hypertension, heart disease, respiratory chronic disorders, cancer patients, patients with transplant, kidney or liver transplant or any other transplant on immunosuppressive drugs are more prone to this infection, and the severity of infection is also more common in these individuals. The patient develops breathlessness and the X-ray chest reveals pneumonia-like shadows. There is also fall of oxygen saturation. The mortality rate is usually high. The pneumonic shadows in the X-ray and CT lung have revealed on autopsy of dead patients as clots in the blood vessels, not only in lungs but other organs like kidney, liver, and brain. So the disease is not only confined to the respiratory system but also afflicts systemic organs. Truly, it is a challenge for doctors, scientists, researchers all over the world, and they have to utilize their creative intelligence to find a definite solution for the pandemic. The current thoughts for the treatment are Oxford University, London, found a 30% decrease in mortality in critically ill patients admitted in their ICUs who were on ventilators and required other drugs were put on betamethasone, the steroid, which is very easily available in India, and they found there was impressive reduction in the mortality. Patients getting antiviral drug infusion in ICU, the researchers have discovered that now a new pump, like we use it in asthma, can inhale this drug and become better. The name of the drug is M.D MEDICINE. They are all antiviral drugs. This drug, India has also started manufacturing. Another advancement in the subject of COVID disease is Glenmark has launched tablets for treatment of this disease named Fabiflu, Favipiravir, for mild to moderate cases. The drug is costly. One tablet costs 103 rupees. The dose is high. At least 18 tablets have to be taken per day in divided doses on first day, and on the other days 4 tablets in the morning and 4 tablets in the evening, or at least 14 days, depends on the viral load. The blood tests have to be done when patient is on treatment. Now, this drug doesn't have much experience. Not more than 100 patients have been given these drugs, though the results are satisfactory. Japan has also tried these drugs, and India has started manufacturing the drug. The doctors take written consent of the patient because much experience is not available as far as this drug is concerned. Besides this antiviral drug, the other drugs and other medicines are in the form of antiviral drugs like rotenavir and opinavir. Earlier they were being used for HIV infection patients, which lead to AIDS, that is called immunodeficiency virus, leading to acute immunodeficiency disease. In patients in India also get interferon beta to increase and boost the human immunity. Hydroxychloroquine we are using in India, but there are variable results from various countries, and some side effects have been revealed like skin rashes and cardiac arrhythmias. So it's essential to get patient's ECG records done. Patient needs to be on monitors. Though we have used these drugs for years together for patients of malaria, these patients who are severe in infection need continuous cardiac monitoring, respiratory monitoring, and their vital signs need to be monitored, and regular blood tests to be done to see the load of virus. They also need physiotherapy. The specialist for mild and moderate cases, if you happen not to get admission in the hospital, for some time patient can be managed at home. For these, you need some devices and learning of those devices. The first device is pulse oximeter. This is a small device and it measures your oxygen saturation. You put the button on, there is a battery in it, put finger next to the thumb and you will see your oxygen saturation on the monitor. Now, normal oxygen saturation should be 95 to 100. If it is less than 93, then you need to be put on oxygen, and a small oxygen cylinder can be kept at home also. Of course, it is inflammable, so one should not take it near fire or do any cigarette smoking while the oxygen cylinder is placed in the patient's room. There is another thermometer. From a distance, it can measure your temperature without touching you. The drugs given to mild patients are paracetamol for fever, azithromycin for infection as an antibiotic, the superimposed bacterial infection, and patients' immunity needs to be increased by giving balanced diet. Patient needs to be well hydrated. Vitamins like vitamin C, D, and zinc as a mineral can be added to the diet. We have to maintain oxygen saturation above 95 and till 100. So these patients can be given a chance to stay at home and manage their own disease with the help of a qualified nurse and doctor visiting them once or twice a week. Now, immune system and coronavirus has a very close relationship. One has to have good immunity. The immune system in human beings exists in lymphatic system, reticuloendothelial system, bone marrow, thymus, and spleen. Like we have white blood cells in the peripheral blood, they are called leukocytes. These leukocytes present in the immune system are called T cell, T helper cell, B cell, and neutralizing killer cells. B cells prepare antibodies. T cell fights with the virus and destroys it. The helper T cell, they are to boost our immunity. The recovery of patient depends a lot on his immunity, and to boost immunity, take balanced diet, no junk food, do regular exercises, be optimistic, do yoga and meditation, have special support emotional support, clean environment, maintain hygiene, frequent hand washing for minimum 6 to 10 times a day and for more than 10 to 20 seconds. Please do follow the norm prescribed by the center and state government advisory, like wearing a mask is mandatory, failing which you will have to pay high penalty. Maintaining social distance of 1 to 2 meters is important. Wearing goggles to prevent entry of virus from the eyes helps. Body hydration, plenty of water, other fluids to be taken in adequate amount. Avoid other infection. They can also be harmful during this viral infection, the coronavirus. In the hospital, the frontline warriors must wear PPE, disposable head, cap, shoe covers. Goggles are essential for front warriors, and they need to change their clothes and wash them as soon as they reach home after duty, before they come in contact with their family members. Stay calm, take minimum 8 hours sleep, take vitamin C, vitamin D, and zinc daily if possible. Those patients who make good recovery and have sufficient antibodies to the virus, they may be fit to donate blood from which the plasma is extracted with viral antibodies and can be infused into the seriously ill patient on ventilators, and there is a probability that their lives can be saved. This is called convalescent plasma therapy. The entry of the virus into the human cell, you'll be curious to know about it. The human cell wall has ACE2 receptors. The virus spikes, gets absorbed on the surface and penetrates the cell. Inside the cell, it lives like a parasite and multiplies rapidly, causing destruction of the cell from one to the other and at such a rapid speed, and further causes inflammatory reaction first in the respiratory system and then afflicts other organs of the body. Researchers have found COVID-19 more in males as compared to females. Similarly, a correlation with blood group is also found. This virus is less common in people with blood group O and more common in people with blood group A and AB. ACE stands for angiotensin converting enzyme receptors on the human cell wall. Coronavirus is an RNA virus. Some of the respiratory viruses may be DNA, and a few have both RNA, that means ribonucleic acid, and DNA, deoxyribonucleic acid. Lab tests for coronaviruses are nasal swab for viral antigen, throat swab again for estimation of viral antigen, and these test results can be available within 30 minutes. The blood antibody test takes minimum 48 hours. ELISA test is enzyme-linked serum assay, and RT-PCR, reverse transcriptase polymerase chain reaction, complete hemogram for white blood cell, total body tests including liver, kidney, blood sugar, ECG, serum electrolytes, cardiac monitoring, and frequent BP records. A patient who recovers from coronavirus, there is no guarantee that reinfection will not occur. My dear friends, in the end, I would like to say a virus, though very virulent for the respiratory system, has a very little size and weight, but has declared a war against humanity. It has hit us hard. It's a war against the virus. We have accepted the challenge. We'll put together our creative intelligence and defeat the virus one day.